Thousands of Americans receive joint replacements every year. There is a technique being used at MedStar Georgetown University Hospital that is literally bloodless. Dr. Mark Zawaday, the director of bloodless surgery at the hospital, joins us now. Boy, this is very interesting. First of all, let's just talk about the joints that can be replaced. Not every joint can be replaced, is that right?
Well, some are more successful than others, and the most common ones are the hip joint, the knee joint, and the shoulder joint. You can have ankle replacements. They do cervical disc replacements in your spine, but the most common ones, far and wide, are the hip and knee, where there were approximately 700,000 knee replacements in the United States last year, and probably close to 400,000 hip replacements done in the last year.
And those are being done successfully. I mean, I know young people, older people, people in the middle who've had these replacements, and they're feeling great.
Well, that's one of the big misperceptions that a lot of patients come in with, that they know someone who's had a knee replacement and have done terribly with an infection or pain. Unfortunately, that's a very small percentage of the cases. Over 95% are successful. So you tend to hear more about the patients that you see limping and you see the problems, as opposed to the 9 out of 10 people who are getting back to normal function and normal life and get their mobility back.
So do you have a difficult time trying to undo that that sort of thinking? If you know, well, I know 2 people who've had it, and if somebody needs the procedure, do you have a difficult time undoing what they've already learned, negatively or?
Well, it's part of the education process that we go through, because you don't wake up and say, that'd be fun to have my hip replaced.
Right, right.
You do it based on need, and it's a slow and gradual process. The pain associated with arthritis, and that's an important part of this. Pain is what drives the need to have a joint replaced, and it's, you know, at first it's a little more of a nuisance, and then over time it becomes worse and worse, and it's gradual and slow and a steady onset that it's amazing what you can get used to. And so, but you do often with patients, we talk about what can be done, what the solutions are, and what it's like to go through a joint replacement. And at some point you feel, I've got to do something and to get rid of the pain.
And again, as I said, this isn't just in elderly people. I think a lot of times people think knee needs to be replaced, a hip needs to be replaced, or it's my grandmother, or it's my mother. No, I mean, it can happen to anyone.
That's exactly right. And it used to be that people were told to wait until you're over 65. Part of that was in the 70s and 80s when these were becoming more common. We didn't really, you know, the industry didn't really know how long they were going to last. So, of course, it made more sense to do it in older patients. And what we have are seeing more and more younger patients in their 30s and 40s and 50s have knee and hip problems. And
is this because of running, or?
It's a combination. You know, we're active. We tend to injure our joints more. You know, everybody's out doing all sorts of, you know, sports, and it does catch up to you.
And extreme things. Like I know I do extreme exercises.
And it just happens. I think what used to happen is people would limp along literally for years and years using canes, you know, barely able to get around. And now we have an answer, and the materials we use are much more successful, and they actually work better. So we're finding that we can do them safely and effectively in younger patients.
Let's talk about the procedure that you do, because it's bloodless, and that's cool.
well, what we do is it all goes back to about 4 years ago. The Jehovah's Witness community came to us at Georgetown and asked to develop a program with them. And the Jehovah's Witness patients do not accept blood transfusions as part of their religious beliefs. And so we tried to create a program where they could come in and be accommodated and feel welcome. And what we found is that as we found new ways to avoid blood transfusions, it benefited, you know, the rest of the patient population. And so we've evolved into really looking at our use of blood transfusions. Blood can and does save lives. That's but when it's used, we were using perhaps inappropriately, and we had too quick of a trigger for giving blood. We thought there was no harm. What we found is that patients do have a reaction in the sense that their immune system is knocked down a little bit, so it can lead to higher infection rates, and there are a number of different things that it's often better to avoid blood transfusions if we can.
Dr. Mark Zawaday, the director of bloodless surgery at MedStar Georgetown University Hospital, thank you so much for coming on today to talk to us about joint replacements.
You're welcome.